Good morning, guys. I hope we're all sparkly. I've been to the sea with Her Royal Highness for a tepid water dip. It was still quite cold. Been to the gym. I've run the dogs with my weighted vest. I am now at work. Yeah, it's Sunday and I'm at work. Why? Because the work needs to get done. I had a few days off last week, went to Le Mans, which was epic. So the workload has doubled and I'm here on a Sunday. Kill me now. Earn my reward. My reward is what? Working on a Sunday? Listen, it is what it is. Get on with it. Life is not all about sunshine and rainbows and sunrises, sunsets and going, oh, isn't life wonderful? Sometimes it's pretty hard and you've got to pull yourself together. With low testosterone, that's pretty difficult. You can't see the wood for the trees. So you say, poor me, poor me. Nobody cares. Work harder. You've got to pull yourself back. Got to get yourself back to normal, whatever that is. That is hopefully the resolution of the negative symptoms that you've got right now. Realizing that testosterone is a foundation and it's just a foundation. You have to put the work in to earn your reward. You have to go, this glass is half full, because you can still see it as glass half empty. Why? Lots of reasons. But you've got to have the right attitude because nobody cares. Work harder. You are the star of your own movie. You need to apply a level of objectivity to your subjective experience. With low testosterone, that's very difficult because, as we spoke about in a previous video, you've got a triangle. One arm of the triangle is your hormones, and there's a chronicity to that. One of the other arms is your brain, and the other arm is your nervous system, which again is acute. It's reactionary. And we want to have a considered response. So normal testosterone levels will give you the opportunity to have a cool, calm, considered response to the situation. Understanding, estradiol, empathy and insight. But too much causes emotional states and anxiety. You can see where this is going. Testosterone, drive, determination, motivation. DHT, aggression, but only in the right proportion, because it's all about ratios. Again, we used that analogy the other day about the graphic equalizer. Testosterone is fundamental. If you've got low testosterone, everything has to go down. If you've got erratic testosterone levels, your body doesn't know what's going on. You want to be microdosing testosterone replacement therapy because it is the most effective way of doing TRT. Well, I don't want to inject every day. I want to do Monday, Wednesday and Friday because, you know, physiology takes a break at the weekend. It doesn't. Every day is the same. It is a 24-hour cycle. Anabolic processes predominate at night time, catabolic in the daytime, yin yang. My God, how many times do we have to go over this? So, what are you going to do about it? You're going to go to the path of least resistance, maximum reward. No, you're not, are you? You're going to apply that objectivity to your subjective experience, and only you can do that. So do it. So what are you going to do? Well, if you've got symptoms of low testosterone, namely low mood, tiredness, brain fog, low libido, you've got some physical symptoms too. Hopefully not, but perhaps erectile dysfunction, loss of lean muscle mass. You're gaining fat despite having a healthy diet, training regularly. Remember, you can't out-train a poor diet. You're not supposed to be efficient at burning calories. We wouldn't have colonized the world if we needed to stop every 5 minutes for a Snickers bar, would we? But you are faced with food shops everywhere. You're pre-programmed to want food. You should have the attitude of only eating what you need, not what you want, because what you want is your emotions. And we said before, didn't we? Screw your emotions. Understand your physiology, then your psychology, and your emotions will be positive with the right perspective and attitude. And only you can do that. So we have to go back to nature. We have to understand that at our core, we are animals. Our highest state of consciousness is a blessing, but we use it as a curse and a crux because we don't understand what we should be doing. Now, we talk about principles, not rules, because you can't live really according to rules in a weird world, because we are kind of aliens in this world. We're not supposed to be doing the things that we're doing, but we have to do these things to become productive members of society. Hello, Dexter. I love you. So what's it all about? He always distracts me. It's about earning your reward. Understanding that there's a 24-hour cycle. Wake up, activity, alertness, earn the reward food, transition into a restful state to then transition into sleep, and repeat. Men, we're pretty simple. We're pretty simple. We have pretty simple needs. You know what they are. You want to feel valued. So, what are you going to have to do? Put some work in. You don't want to be labelled. We label things too much, too often. And there's a fluidity, an adaptability to our state of consciousness that we need to work towards positivity, not negativity, because it's very easy to delve into negativity and have persecutory delusions. But we need to also understand that we can't always be the chief. We sometimes have to be the Indian. However, you do need to be your own chief. So you might be doing things that you don't want to do. I don't want to be here on a Sunday, but I got to do it because I have a responsibility to well over 2,500 patients. I've got a responsibility to my team. I've got a responsibility to my family. I have to put the work in. I feel like the Indian. You can tell, oh, Doc, you're amazing. I've got to sit here on a Sunday afternoon and work. I could feel sorry for myself, but I'm not gonna. I've got healthy testosterone levels. Why? Because I microdose testosterone. My dose is carefully titrated according to effect. I put the work in, so I'm not going to let it get me down. I'm going to apply objectivity to my subjective. I don't want to be here on a Sunday. Suck it up, buttercup. Get on with it. Nobody else is going to do it. So if you sit here again, oh, I feel sorry for myself, that ain't helping anybody. It ain't helping me. So what am I going to do? I want to get on with it. So we can't always earn your reward in the traditional sense and go, yeah, well, look at me, you're fucking amazing. Karma is not what people think it is. It's you get what you get, and you have to apply this sense of calm, objectivity to the situation. You don't get what you deserve sometimes. Sad fact of life. I didn't deserve low testosterone. I didn't do anything wrong. I don't care. Get on with it. What can you do about it? So, put the work in. Reach out for support if you need support. You don't have to draw up the drawbridge and sit there in isolation, because isolation is a major risk factor for depression. And we don't want you to be depressed, Nobody wants you to be depressed. So get on with it. I ain't got much else to say. Got to go do some emails. So yeah, one more time. Earn your reward.